Welcome to the Healthusiasm podcast, a panel discussion on behaviors, innovations, and trends in health and self-care. My name is Christophe Jauquet. I'm a global keynote speaker on the future of health and self-care business, and I'm also the author of the book called Healthusiasm. Now, if you're new to the show, you might wonder what Healthusiasm is all about. Well, Healthusiasm is the aspiration that we all have to be healthy and happy. And as a result of this, every company or organization is now more than ever focused on making their customers healthier and happier. And so, every month I discuss with a panel of experts the positive changes that are shaping our health and happiness. This is the first episode of the second season, and in the show, the panel will discuss if rewarding good health behaviors is something, nothing, or everything, and also what the Barbie movie means, or rather could or should mean, for health and self-care. And for this discussion, we have three of your beloved experts in the panel. Calling in from Barcelona is our digital health connector, Aline Noizet.
Hola.
Our American in Paris and medical expert in digital health, Aditi Joshi.
Hi, everyone.
And from London, customer experience and research expert, Krupa Sutar.
Hi, everybody.
This means we are missing our human experience expert, Mo Suina. But nevertheless, together we will today again amplify the healthusiasms that we see in articles, new business ventures, or simply even in the world around us. So, tell me, Aditi, what are the healthusiasms that you witness in the past month?
So I'm going to start out with something positive because I know that I have a tendency to think through things and look at how it's going to affect the health system in general. But we were talking about, a couple of things. Amazon Clinic launched. So again, Amazon is starting out to expand on what kind of telehealth use cases they are using. But what I wanted to talk about today is that they've actually started expanding how they're using other parts of their clinic and clinical workflows. So one is using AI for scribes and workflow efficiency. So the idea is that they have a health scribe where they can generate clinical notes from the conversations that patients and clinicians are having. We've all been using ChatGPT. We all have experimented with Bard maybe as well and figured out how and what works for both our speech and what we write. And so it's interesting that we're going to be using that for clinical notes. I've tried a little, not with the AWS, but I've tried some other companies' clinical scribes, and some of them are actually really good. And I find it will be really helpful because a lot of what patients complain about sometimes is that we're not paying attention to them because we're typing or we're taking notes. And this takes away that problem. So you actually can concentrate on the patient without distractions and then figure out later the edits you need to do if it's really that good. So I find that would be really interesting. And then the other thing they're doing, which is not related to this, but really they're figuring out ways to store large amounts of medical images. So consider radiology images and being able to upload it. So generally, most patients don't really have access to those images. And even for clinicians, so when I would try to find radiological images, I would have to pop into another screen in another program. And this may take that away because it'll be in one place and it'll be able to store everything. And so people will be able to access not just the reports, but the actual images.
Yeah, it's super interesting. And I think in previous shows, we talked about how even Microsoft is using ChatGPT to do pretty much the same. They have this company called Nuance, and it would also do pretty much the similar things like transcribing patient interactions. And we noticed, I think a month ago in June 2023, the Mayo Clinic hinted at broader plans with Google Cloud, where they would want to do pretty much the same thing as what I think AWS is now offering as well. And what they want to do with the cloud that Google is offering, they want to unlock the sources of information and find new information, find new interpretations of the information and the overall very complex patient medical history, of course. What was interesting, by the way, related to hospitals and the way that they use AI and all these types of surveys, whether it's coming from Microsoft, AWS, or Google, is that apparently the Wall Street Journal, they reported that Google is already testing its MedPalm 2 AI chat technology, which is basically the ChatGPT from Google, if you will. But it's been tested in the Mayo Clinic. Or the Mayo Clinic, as some may say. So basically as well to, although it's not even ready, right? But to do the same thing, to analyze data and to make sure that we can learn and maybe even unburden some of the administration in hospitals. By the way, I've heard that British National Health Services in the UK Krupa, is giving 27 million in grants to adopt generative AI solutions in hospitals. So I think we'll see a lot of things happening there with AI in hospitals. But not everything is good with AI, right, Aditi? You can be negative now. Just go.
No, that's fair. Yeah, because I can't stop. I just want to make sure, because we talk about AI a lot. And if you looked at everyone's feeds, LinkedIn, or any of the feeds where we interact, people are really excited about AI. But, in the US, there's always this problem of what we pay for in healthcare. And so there's an entire system based on looking at what claims are happening and deciding whether they're paid for or not. And there have been cases where insurance companies are using AI and determining that this patient shouldn't have this paid for because technically they should be better. They should be better by now based on this algorithm. And there are cases and many stories of people who were not better. They were actually worse and they needed more care. So there is this limit too, that we don't necessarily know how all these algorithms work. We have to still look at individuals as individuals. And we certainly shouldn't pay for people deny paying for people's healthcare if they are still needing more care. Definitely not relying on a machine, but really looking at the patient, right? And this is what people are worried about, that it's going to become a machine that's telling me what to do rather than looking at me as a human. And it's already happening. And so we have to make sure that we're overcoming that before it becomes worse.
Yeah, we're not there yet. And it's definitely some things to keep an eye on. Just a funny note on AI. I saw something passing by Andreessen Horowitz. We talked about him in the previous episode. But apparently somebody from the VC company was invited, you're going to love this, to be part of a panel. And the panel would talk about, and this is the title, how can AI be used with fax machines to unburden the administration in hospitals? Fax machines in hospitals, healthcare, and AI, and there's a lot to be discussed still, I think. But we're nowhere there yet. I think it's also people from Google, even if it's tested in MedPalm2 is tested in the Mayo Clinic, they say that we still need to learn a lot. And I think your fear is rightfully so, Aditi. But let's just look on the bright side. There's a lot of things that can happen with AI. And I believe that Apple is doing quite some stuff with AI as well. And more specifically with the AirPods, Aline.
Exactly. Yeah. So it was announced this week that Apple just filed a patent of what looks like AirPods that we know with biosensors inside that can track brain activity. So the electrodes would be in the earphones and they would measure biosignals and electrical activity from the brain. So we can imagine that the data collected from the AirPods could, for instance, tell us when we need a break, which music makes us more productive, and also detects early signs of Alzheimer's. So quite exciting.
Yeah, totally. And it's really about how can we live better with ourselves? How can we optimize our own functioning? And that's a creative segue I made here because I want to talk about human functioning. Because the WHO came up with something new, an indicator to measure health, which is called human functioning. Apparently, and correct me if I'm wrong, Aditi, but I think there's two indicators that are commonly used to monitor health in populations or in society at large, and that is morbidity and mortality. So if we're talking epidemiology, we're talking about morbidity and mortality in general. Now, the WHO wants to add a third indicator, which is called human functioning. And the idea behind this new way of thinking, or maybe even this paradigm shift, is the following. They want to look at the combination of biological health and lived health. How do people function in society? In a way, it's like the value that health has on the individual, but also the value that health has on society at large, and even vice versa. How does society has an impact on health? And so the reason why they are shifting this focus has to do with the Sustainable Development Goals, the SDGs. These SDGs were set up by the United Nations, and basically the aim of these SDGs is to face global challenges together. You probably have heard of these SDGs. But one particular SDG, the third one, is about good health and well-being. More particularly, it says to ensure healthy living and promote well-being for all ages. And so the idea or the conviction by the WHO and many of the scientific people behind it is that if we only would look at morbidity and mortality, it would not be sufficient to achieve this sustainable development goal of good health and well-being. And that's why they want to add human functioning as a third indicator to monitor. I think it's a very interesting development. It might require a total shift in thinking. Rightfully so, it's called a paradigm shift. So I'm very curious to see what it will bring. But it could profoundly benefit, health practices, even health research, education, policy, It will require even a different multidisciplinary approach if we think about how this health has an impact on society and vice versa. Talking about society, something is happening in the UK, isn't it, Krupa?
Yes. So, there was something that happened worldwide last week. So that was World IVF Day, and that was on the 25th of July. The World Health Organization, for people who may not know, the data shows that infertility affects 1 in 6 people worldwide. So it's an extremely difficult time, both emotionally and physically, for those involved. Anyhow, something is happening in Scotland. And it's to do with our King Charles. And what I was reading about recently is that he's established a dedicated team of fertility experts, but not just medical doctors. He has moved into including naturopaths, acupuncturists, and nutritionists. And for those who don't know, King Charles has actually been a long-time advocate of alternative methods. So, for example, he was long promoting organic farming, for example, and he's promoted that for the last 30 to 40 years, so way before many people were talking about it, and just generally holistic living. So this program actually will address a combination of natural therapies that he will work on with a number of his experts, which will include herbal supplements, dietary modifications, and stress reduction techniques. There'll be naturopaths on hand, nutritionists, and acupuncture too for the physical side of the treatment, but also he's incorporating emotional well-being, which we know fertility doesn't just affect the body, it affects your emotions too. So he'll have counsellors on hand as well. And what they're going to do is select 40 lucky women. I'm not too sure how this selection is going to be made, but each of those will be in Scotland, and they'll have comprehensive assessments to identify any potential barriers to conception, and then they'll have personalised treatment plans. So, for example, in the UK, IVF, 1 round can cost around £20,000, and that's just the medical side of it. So that's obviously private, and that would be for a top-end clinic. And if you're lucky enough to have it on the NHS and it's being pulled, you may just get 1 round, but otherwise it's costing thousands of pounds. And then you have all this additional nutrition and whatnot on top. So the fact that these women are going to be offered it is just so amazing. And it's going to be really interesting to see what the outcome of this, because it could be really life-changing for anyone involved.
Yeah, I love it. And going from fertility and making children to actually innovations for children's health. I got one from Alba Health. It's a Danish foodie startup that is dedicated to providing digital gut health support for children. And they just announced that they have secured about 2 million in pre-seed funding, which is quite a bit of money, certainly for pre-seed. But the reason why I think this is interesting is because there isn't so much innovation in child health, I believe. It's not that I see a lot, at least. And we know that gut health is already important. So knowing that they will focus now on gut health for children is I think, very interesting, because I think there's a lot of scientific support that we know that the way that people eat or children eat very early on in their lives might definitely affect their health outcomes later. So a very interesting development in child health, a lovely innovation. Aline, you had another innovation for us to share.
Exactly. So it's also coming from the UK, from researchers from the University of Leeds have been working on a tiny surgical robot that could transform detection and treatment of cancers. So starting with lung cancer. I think it's really good because we know that lung cancer is on the rise, especially amongst women, and that it has the highest cancer mortality rate. So it's good news. So it's actually a 2 millimeters tiny robot that can travel deep into the lungs, and it's controlled by magnets, and it can treat the first signs of cancers. It can actually reach the smallest bronchial tubes of the lungs. So I think it's fantastic news, can really make treatment more effective and more targeted. And the other use case that they were mentioning in that article is that after that, they could use it also for brain surgery, for more precise surgery.
It's amazing. I'm curious to see when it comes to market, because I've seen it a couple of years ago as well in a presentation by IMEC, a Belgian tech company, where they actually have very specific nanotechnologies that can go into the blood and actually do similar things. So a lot of Healthusiasm is coming our way indeed. I have a couple of weirder ones to end with, or funny ones if you want. Real quick fire. Does anybody knows what the Paris syndrome is? Do you know what it is?
Yeah, I've heard of it.
So I don't know did you suffer from it when you moved to Paris?
Oh, no.
Okay.
But I also don't glorify Paris in that manner, but I know exactly what it is.
So it's indeed, if people glorify Paris up front, apparently Jews are so disappointed when they arrive in Paris that they even risk to faint. So it's a funny thing. It's not an official disease. It's not on the DSM-5, but apparently it happens a lot, and definitely with Japanese tourists. So here you go. Something that you might not have known. Has anybody seen the latest announcements by Hims & Hers, the San Francisco-based telemedicine wellness company? They brought out some mints. So they're called heart mints. Any idea what they could do? They're actually, Viagra in mint form. So that's why they called heart mints, I guess. And then finally, as the last one to wrap things up here, South Koreans are 1 year younger since June the 28th. Have you heard about that? Apparently in South Korea, the traditional practice of considering babies is that, I'll put it that way. The traditional practice is to consider babies 1 year old when they are born. But the thing is, that's the Korean age. And so in international standards are different. We saw that we're 0 years old, right? When we get born. And that's the international age. And so they now changed it back to the international age because there was, consensus that everybody wanted to have the same age. So which means that basically South Koreans are now 1 year younger than they were considered previously. But it's even more complex because they also have calendar age, which is everybody turns 1 year older on the first year of January. And that is the age that is used if you want to buy alcohol or nicotine. So 3 types of ages, which now they want to, switch to the international age, which we all use. It's not that they are healthier or that their biological age is 1 year younger, but legally speaking, they are all 1 year younger. And so it is. I thank you all for your Healthusiasms. It is in Healthusiasm world indeed. There's so many positive changes that are making our world a little healthier and happier every day. If you want to know more about these Healthusiasms, go to healthusiasm.com and subscribe to our newsletter. The Healthusiasms from this show will be summarized for you into a monthly newsletter. And by subscribing, you will also have access to other exclusive content like Healthusiasms that might not have made the show. Okay, that's it. Let's move to the next segment of the Healthusiasm podcast. Is it something, nothing, or everything? So every month, one of the panelists brings an idea, an innovation, or evolution forward that sparked their Healthusiasm. The rest of the panel will then debate and share their opinion about it. Do they find it something, nothing, or everything? Aline, what sparked your Healthusiasm this month?
So I read an interesting article about Good RX. So it's a US-based online pharmacy and telehealth app. And they just launched their digital medicine cabinet. So to reward people for taking their meds with the idea to address medication adherence. And we know it's a big topic. So that medicine cabinet enables users to check price comparisons for the medicine, to get reminders to take them, and also to refill them. And they can even earn financial rewards for taking their medicines. And why is that important? So studies show that 50% of the patients with chronic illnesses struggle to take their medications as they should. And in the US, for instance, that represents a cost to the healthcare system of roughly 300 billion annually. So it's a lot. So there's already many companies active in the space focusing on reminding people to take their medicine. But Good RX are actually positioning themselves a bit differently, focusing more on the barriers to medication. So addressing more the cost and the lack of insurance for the people. So, but basically they want to reward people for staying healthy. That's the idea of the medicine cabinet. And I also like that story because it reminded me of a conference that I attended in France about a month ago. And there was someone from the French Social Security, the national system. And during the Q&A session, someone from the audience asked him a question that I found very interesting. It was like, could we imagine that national social security, like the French one, could reward citizens for living healthy lifestyle? And the answer from that person was, no, it's too avant-garde. So now I'm curious to hear your thoughts about that. I've got mainly two big questions around that. Is rewarding people for taking their meds, is that something, nothing or everything? Should we reward people for taking their medicine? Is that the way to go? Would it ensure long-term sustainability adherence in your sense? And my second question related to that conference, should public insurances, and especially in European countries where the system are different as we know, should they reward people for living healthier lifestyles? And because it will cost less to the people to the systems in the long term. Aditi, our doctor, what do you think?
Well, I'll start out by saying that obviously financial incentives work. If you look at any book on behavioral economics, it works, including for healthcare, and people have tried various things for incentivizing people. So it could work. And in the US, generally, they don't pay outright, but what they do is they give you breaks on your insurance, or they give you money back if you meet certain criteria. So those programs have already existed. And they work to varying degrees. I'll say personally that when I've tried them, sometimes what they're asking you to do is just the barrier is a little bit too high. So a lot of people may not actually succeed at them. But I think that's the goal. So I think that's the problem, right? So you have to figure out what the incentives are for the system that you're at. The US does not have the incentive to actually decrease costs. They just don't. So they try these programs, but I don't think they make it easier for anybody to actually do them. So saying that, the second thing I would say is that where is the end of this, right? Because when you're incentivizing people using finances, but it's not to actually improve their health, that there has to be another incentive as well, because otherwise you're just going to be paying them forever. I mean, is that the goal? Not really, right? You want them to get into the habit or find another reason to be invested in their health so that they don't do that or don't need the finances eventually. We assume that people want their health to be good. They want to have good health. But what I think people fail to realize, and all doctors will know this, is that a lot of the chronic diseases, the things that are not healthy for you, they actually don't have any consequences until they do. So high blood pressure is a good example. Smoking is a great example, right? People can do that for years and years and years, have uncontrolled blood pressure. They can smoke for years. And then eventually it will catch up with you. They always do. You're going to have something that is irreversible. They're going to have a health consequence that they can't do anything about, but then it's too late. Right. And so I think because we can't feel those incentives, we can't actually understand what those consequences are. It makes it much harder to incentivize the health. So in those cases, maybe finances would work. But I think, I don't think I would do it forever. So in that example, I would say, all right, so once you have gotten into the habit of, let's say, taking your blood pressure medicine, then maybe you don't need the financial incentives. Right. For smoking, that takes a much longer to quit. But it could be that for every year that you don't smoke or for every month that you don't smoke, there's some incentive until you've really quit. But yeah, so I think that, it could work, but I just don't think it's a long-term plan. We need another incentive for getting people to improve their health.
Yeah, that was exactly one of the points from the article, that people don't think it will be sustainable in the long run. People also get bored. And even of those rewards, after some time, they're not even interested in that, in those rewards. Yeah. Krupa, what do you think? Something, nothing, or everything? And what about the NHS? Could we imagine giving rewards to citizens, or maybe they're doing something around it already?
There have been schemes that I've been reading about related to rewarding people. But we must remember the NHS is heavily burdened here, and obviously it's publicly funded and there are so many cuts. And so it's a really difficult one for the UK and how we deal with it. But this whole concept of rewarding goes back quite a while. It's a commonly known behavioral psychology technique. Everyone may have heard of the study from Pavlov's dogs related to stimulus and response. And in this case, the stimulus is obviously the medication, hoping to get better. The response is, taking the medication or not. And, you're going to have a negative consequence, obviously, if you don't take it. But yeah, as Aditi said, behavioural science has shown that actually positive reinforcement leads to better outcomes rather than taking it away. And we know in the UK, where we have ad campaigns on health. If there's anything that shows a negative outcomes, it's never going to lead to a positive outcome. You've got to show the benefits of actually doing something instead to the public. So what I believe, and I was actually reading a few studies on this, is that the short term, we know that short term works better rather than long term. So in this case, giving people the medication or reminding them they will take that medication, and short term incentives work better because of the instant gratification rather than long term. But I do believe, for me, I'm going towards nothing to something on this, because if we can begin to nudge people in the right direction, as Aditi was saying, once you've started to continuously take your blood pressure medication, what's the next thing, rather than just having that same reward, I feel like that would be far more beneficial. But what's missing for me is that it's always about treating. How much education are we actually doing on prevention? If we're treating, I know it's going to be a huge burden on the system. And for me, it's around prevention and preventing. That education should be coming much earlier. We've talked about children in the past, and actually starting at home, for example. That will ultimately reduce the burden on the health system. But the questions that I was asking relating to this article is, who's going to fund this? Especially in the UK, if it becomes something that the public fund, it's a huge issue. And then what happens after the incentives stop? We just go back to square one. And then we must remember that this was actually a digital health solution. Not everybody has digital health. Not everyone has access to smartphones. And so what about the people who don't? And how are they what's going to happen to their health? So, I have too many questions on this for me to say that it's something or everything. I'm leaning more towards nothing to something.
Okay. In my view, I see it more, it will be an investment from the health systems, and we know they're in trouble, but at the end, it will reduce the cost, like in the medium long term, because those people who are doing prevention that you're saying, they're not getting a cancer. That's a cost that won't be incurred to the system. Christophe, what's your view on that? Something, nothing, or everything?
I'm just going to be the healthusiast here, and I want to say this is everything, or at least I hope this is everything. And I think there's already some signs today that this could really become everything. I want to speak about two things. You mentioned avant-garde. Is it too avant-garde? And I want to talk about the long-term perspective that both Aditi and Krupa mentioned. First, the avant-garde thing. The most downloaded health app in 2022 was Sweatcoin. Previous years, it was always MyFitnessPal, Strava, Fitbit. In 2022, the most downloaded health app was Sweatcoin. It was a top 1 app in 58 different countries, and it had a total of 52 million downloads, which is enormous. So what is it, Sweatcoin? It's actually a digital currency that you receive for moving. So it's a move to earn type of approach. You can earn 10 Sweatcoins per day with a free plan, and the 10 Sweatcoins you achieve by stepping 10,000 steps per day. It's not a lot of money if you look at it on an entire year. If you imagine if you would walk for 365 days, you would earn $22, which is not a lot of 20 euros, let's say. So it's not a lot of money. But they offer a variety of different ways of motivating people. Because if it would just only be the $20, it would never work. But you have specific discounts, and these discounts vary, they change. So you can use your Sweatcoins to have discounts which value then more than just the $20. You can also participate in auctions. So you can use your Sweatcoins to participate in auction, and you can win an Apple Watch, or you can win something else, which is valued a lot more as well. And there's a lot of things that where you can boost the gamification kind of type of things, where you can boost your activity for 20 minutes per day, or you can buy more coins and all of those things. The reason why it is super interesting is because they're very creative in the way that they motivate people. And compared to, we're talking about barriers are too high, and what is the barrier that you need to put, and what are the goals that we want to achieve. Well, these incentive schemes that Sweatcoin is using is not related to a specific goal. It's just a continuous incentive. The more that the little things that you're doing is already rewarded. And it's rewarded by discounts, as I mentioned. It's rewarded by the coins that you can exchange with 300 different parties, 1,000 different products and services that you can do. You asked the question to Krupa, does the NHS already does something today? Well, the NHS did a project with Sweatcoin already. I think it was called the Health Incentive program around something. I can't remember. They co-designed it, at least a prevention program. And it was a 10 weeks program for people at risk for diabetes type 2. And so what they saw is that during these 10 weeks, and it's only 10 weeks, it's not really long term. I'll come to the long term in a little bit, but it's already very good. But then, because in those 10 weeks, 92% of the people completed the program. If you compare that to an industry average, the industry average is about 25%. If you compare that to other initiatives by the National Diabetes Prevention Program that was done in the UK as well, it was only 20%. So 92% is extremely high. And what they saw is that people walked a lot more, they lost weight. So only just positive numbers that came out. And I really like this kind of, move to earn types of approaches, because I really think that even if it's only small, if you're a little bit creative, you can really have people move and be healthier. I think Singapore used the Apple Watch to reward citizens for healthy activities. Whoop, the company Whoop, you might know from the bracelet, they actually pay employees to sleep. So if they achieve their sleeping goals with 85%, they are paid €100 more. So there's a ton of examples out there. And so I'm always thinking about, if this works in the consumer world and prevention settings, how can we extrapolate that into, more value-based healthcare? And I think the second question was, should insurance do that? And what is the long-term goal? I think it's already happening with Vitality, right? And if you don't know Vitality is actually rewarding people, their clients, if they are being healthier. It's a shared value insurance model. So it's basically the same as value-based outcome healthcare systems. But the idea there is that if the patient or the client is doing something good and it's beneficial for the health insurance company, then the money goes back also to the client, which works really well. Because if you look at South Africa, where it exists already for 20 years, so that's a long-term thing I wanted to talk about. If you look at South Africa, where it exists already for 20 years, the Vitality members, I have some numbers here. Let me just quickly read them. They exercise 23% more than non-Vitality members. So the incentives work in that way, that 25% more workouts, 9% more healthier food consumption. They have 30% lower hospital costs compared to other insurance companies. Their mortality rates are 45% lower. And with the most engaged clients, it sometimes even goes up to 76% lower mortality rate. And apparently, and I found this number really strange, but on average, the Vitality clients live 13 to 20 years longer. So talking about, long-term effects, they've been doing it for 20 years. They see these types of numbers. Obviously, the question is, if you're healthy, do you go to Vitality? And is it biased in that way, regard that there's only healthy people subscribing for the Vitality approach? But still, these numbers are not just marginal differences. They're massive differences. So I really believe that, first of all, this is not that avant-garde yet. I mean, there's a healthy base of people that really want to move into that space. And if we look at what has been happening in South Africa for 20 years, there is a potential that it might have a long-term impact as well. So I'm really a fan, and I really hope this is everything. I
agree. And I hope that the health systems see those examples out there. I know the systems are different, but it can inspire them in some way. And for us citizens to benefit from it.
I just need everyone to really understand that that's not how medicine works. And so anybody who actually practices, that's just not how most patients engage with their healthcare. Like, it just doesn't work that way. It'll work for a while, but it won't work forever.
Even if they're rewarded in different creative ways over time?
I really think it has to be at some point coming from themselves. People have to figure out what that incentive is for themselves. It cannot be external forever. It can be just become a habit, right? But I think if you keep giving incentives to people, they're not actually motivated to find that incentive for themselves. That's why we'll see patients all the time, that'll have like a massive heart attack, and then they'll finally quit smoking. That happens all the time, right? So we want to avoid that, but we have to figure out how to give them real information. The education might work. It doesn't really work, right? I used to do that all the time and just say, this is what happens until it works. And that might give some people more information, but it has to come from themselves too.
I agree.
I don't know if anyone I used to smoke. I mean, I am shocked how many people in Europe smoke still. But it's like, all the people know it's bad for you. It's like, how do you actually get them to quit, right? So that's the difference.
Interesting. This is clearly something, and it's clearly something that we can talk about for a little longer. But now it's time for something else. Thanks for that discussion. In this Healthusiasm world, we see the boundaries of industries blurring between the worlds of healthcare, wellness, and consumer businesses. You can see that consumer businesses are slowly moving into wellness and healthcare space, while the healthcare industry is also paying more attention to what is happening outside of their own industry. This brings the following question. What behavior, innovation, or trend from one industry can be worthwhile for another industry? Or in other words, what should we bring inside out or outside in? So tell me, Krupa, what's the idea, the innovation or evolution that you would consider bringing inside out or outside in?
So it's going to be very rude for me not to mention the film that everybody's talking about at the moment. It's not Oppenheimer. No, I'm referring to Barbie. Let's just talk a little bit about this movie. It's a current record breaker from my former employer, where I had so much fun working, and I'm so very heartwarmed to see how well it's doing. Just some quick stats. So on the opening weekend, the movie actually took $356 million. And that's the biggest debut for a film ever directed by a woman. It's so lovely to see. And we know that the movie's been doing really well, not just the movie in itself. And I've seen it and I really loved it myself as well. But the ramifications of the movie are reaching far wider than just a film and a doll brand. So as we know, Barbie is a doll brand and it's the biggest doll brand in the world from Mattel. And what I've been reading about is there have been several articles, or not just several articles, it's been everywhere, all over my LinkedIn, it's been in the news, it's just been everywhere that I'm looking. And it's the impact that it's actually having generally, but the impact on women's health. So this is a bit of a spoiler alert for anyone who hasn't seen it. But towards the end of the movie, we see that Barbie goes for an appointment, and she goes for an appointment to see her gynecologist. And the reason why this is so pivotal is because we know that women's health is underfunded and under-researched. We see that in the UK with the launch of the Women's Health Strategy. But it also raises this question on awareness. Will this lead to more awareness for girls, for women, for those who've got reproductive organs, or for their partners, the men in their life, to visit or to serve as a reminder to visit their practitioner for early or regular checkups? Because we know that women's health after the pandemic hasn't really recovered. We know that breast cancer is on the rise due to the pandemic, for example. We are way behind on treatment. In the US, ZocDoc, which is actually a health marketplace, unveiled a new initiative to inspire women to prioritise going to see their gynecologists. So, this is my question. Given this is a film by a toy manufacturer, what, if any, do you think the implications could be on health? And do you think the healthcare system should leverage the success of the actual film? I'll go to Aileen.
Well, so I saw the film as well, and it was very interesting because, like you, I read a lot. I didn't read the article. I just saw the headings about the film, like Barbie and women's health, and my expectations were very high. And when I saw the film, I was actually quite disappointed. I expected way more. Like, it's only for me like a tiny second in the film. And I think for me, the buzz or the impact is actually the noise around the film, not the film itself, because if I put myself in the foot of like a teenager going to see the film, doesn't tell them much. I think the noise around that, what ZocDoc is doing, as you were mentioning, all the articles, interviews of gynecologists explaining why girls should be there. So that was the incentive to write articles and to educate. I think the issue, and maybe that's related to the previous discussion around reward for healthcare, explaining to girls why they should go to the gynecologist. For me, just seeing the film, her being so excited going to the gynecologist, and that was also quite funny to see, well, I'm not sure we are really so excited going to the gynecologist, but maybe that was also a good thing for the people looking at the film, saying, well, maybe don't be afraid of it. It's going to be fine. Maybe you're going to be surprised once it happens, but why do you need to go? Just going is not enough. Maybe explaining them what will happen, or Yeah, I think for me what was important, and I really like what ZocDoc are doing, because we have to remember that there was a decrease in prevention and checkups following COVID, and now we're seeing a lot of cases of cancer. So reminding people to go and do their checkups is very important. But again, that's more like interpretation of the film for me.
Thanks, Aileen. Yeah, some really good points there, especially about you expecting it to be longer or more content on that piece on women's health. Aditi, what do you think? Have you seen the movie?
I have seen the movie. I saw it last weekend. I don't actually think that I expected anything to be about women's health particularly. So I didn't have that expectation. So I wasn't disappointed by that. I thought that movie was great for exactly what it was. I thought it was hilarious. I think it actually is more relevant to people who are older, who used to play with Barbies. And that's why I thought it was really funny. But as far as using that toward women's health, I think it would be difficult because it is actually just a very small part of that movie, but it is interesting that she's excited about it. You know, I'll say that there maybe is some part that she's like, okay, now I am part of this group. I'm a real human. I'm a real human woman because I need to go see the gynecologist. And so there might be some feeling of camaraderie in that I think is actually happening in this entire change with women's health, especially in health tech, and this whole idea that there is a group of people who need this healthcare. And so a lot of them are building it. So I see that as part of that zeitgeist versus, or as opposed to that causing it. I think it's just more of an indication of it.
Yeah, thank you. Christophe?
Yeah, so I haven't seen the movies. And it's not because I didn't not want to, it's just because I never go to the movies, basically. I'm definitely, when it comes out, I'll watch it for sure. But I haven't seen the movie. So I did some research and I had some thinking about it. I read some articles. There's one thing I'd love to say first, is that we're talking about the impact that Barbie has on women's health and, you know, whether that small part in the movie is actually relevant or not. But you have to think about it. Do you know when Barbie came out, Krupa? And what year it was about?
I should know this. I want to say the 1960s. I will look it up.
It's a little earlier. It's March 9, 1959. So that is basically before oral contraceptives were available, before women were included in clinical studies, before, you know, anything of the women's health evolution that we're seeing in the recent years was happening. I think it's really amazing to see how basically a doll, which was, you know, criticized for unhealthy body ideals and, you know, reinforcing gender stereotypes and what have you, is now becoming basically a role model in a sense for women's health or even diversity and body positivity. And I really love that evolution. It didn't happen overnight, of course. There's a lot of things that happened in the meantime. There was the meditation doll, the diversity dolls. I know in 2016, Barbie had a YouTube channel where she said she was struggling with depression. So, I mean, it just didn't just come overnight, this change of role model. But I really think it's very interesting. And I love the impact that it might have in some ways on health and self-care. And I think it's not even, if you will, fully captured yet, or I think there's even more potential. If I read the articles about Barbie and I added Barbie and health, you had a ton of articles that came forward. And they were mainly about three things that I think were very interesting and that show how much such a franchise or such an icon or such a doll or such a movie can have the way that people look at health. And the three things that I saw always coming by was mental health, skin health, and physical health, more related to feet and ankles specifically. But the mental health part was about Barbie Core. I don't know if you heard about Barbie Core. If you're on TikTok, you might have seen it. Barbie Core has about 9 million views on TikTok. What it is basically you dress up like Barbie. But the thing is behind it, it's an aesthetic trend. But the thing is behind it is that anybody is doing it. It's not just your typical Barbie looking girl that is doing it. Everybody, even men, are dressing up in pink in a sort of Barbie core style. And the idea behind it, I'm not quite sure whether it resonates really well or it's just a fad, a bit like we saw with the Ice Bucket Challenge, if people realize how much of a change it does. But what it does inherently and subconsciously maybe is that it showcases Barbie in a different light. It's because everybody's dressing up in different forms, different types of genders and all of that. It's more of a, if you will, an indirect promotion for diversity and body positivity, which makes it easier for people to to recognize themselves and feel better. I'm also a Barbie, or I can also be a Barbie. So that's the first thing that I always saw coming back, Barbie core, and the impact it might have on mental health. The second thing was related to skin health. Apparently, to have this kind of Barbie-like skin, the movie hired somebody named Jasmina Vico, which is a London-based skin professional. And she worked with the entire cast. And she was the head of hair and makeup. But the thing that she did was not only, putting on makeup, she also helped people with living healthier so that their skin looked healthier. And so I have a list. I'll quickly go through it because it's way too much. But she helped Margot and the rest of the cast with glow lasers and cold lasers, with LED therapy, with lymphatic drainage, with pressure point massage. She applied the Wim Hof method with breath work and cold therapy. She did soundscapes and infrasonic resonance sessions. She had a whole gut protocol where people needed to eat probiotics and other anti-inflammatory supplements. People needed to eat fermented foods like sauerkraut and kimchi and kefir. They were eating all sorts of bitter foods and berries. They had some sort of organic milk thistle tea to protect their liver. All of that to have better skin health. And I've seen a ton of articles in fashion magazines talking about that person, Jasmina Vico, and what she did. And it really opened up an amazing debate about how to take care of your skin in different ways. So that's the second one. The third one was about feet and ankle strength or health. The Barbie foot challenge. I don't know if you've seen it. At a certain moment, apparently in the movie, Barbie steps out of her shoes and she continues walking like a Barbie doll on the tips of her feet. And apparently it's also a trend on TikTok in the meantime. And it's to strengthen your ankles. It's to strengthen your feet. So I don't know. What I like about it is that there's a ton of articles about health that is coming from this movie. Maybe the movie itself wasn't about health, although it was a lot about, self-love, body positivity, kindness, and all of that. But there's a lot that, as Aline was saying, right? There's a lot of buzz around it that might have an impact on health and self-care. To answer your question, should healthcare do a little bit more? My question would be, or my challenge would be, how can healthcare even use such a virtual influencer to have an impact on people's health? How can we help with prevention? I know the WHO done it with Nox, which is a virtual influencer on Instagram, to have people vaccinated. So why not using Barbie? I think there's definitely an upside. There's definitely an opportunity. This is not something that we typically think of or think about from within the healthcare industry.
No, thank you, Christophe. And it's never really been thought about with Barbie and its impact, the impact of the brand on health overall. It was really lovely to see the movie yesterday, but I agree with Aline. I did feel that the ending, I would have liked the ending to have been slightly longer myself. So I felt a little bit let down, but I'm really looking forward to seeing, okay, what does this do? Does this increase awareness? Does it actually lead to more women or girls talking about gynecology? Not just women and girls, actually, just society as a whole. Families, is it going to lead to conversations within families about what is gynecology, what is gynecological health? It would be really fascinating to see what this does, or if it is, say, for example, just as bad as a consequence of the movie. Just to pick up on a few things you mentioned as well about the implications when you looked at Barbie and health. So skin health, this was one of Barbie's first human experiences when actually she experienced cellulite. So that's probably the reason for skin health coming up as well within the articles, because that's what happens. She enters her human experience. And then in terms of foot and ankle health, yes, she starts off by actually walking like a Barbie. But again, one of her experiences actually is that she walks as humans do on flat feet. And it was quite a shock to all the other Barbies that are in the movie as well. And that's when she realized that actually, okay, something is happening, something is changing. And she went to see another type of Barbie. But I loved the movie, and I loved how all the different Barbies were actually working together and supporting one another. And that was really beautiful to see, rather than actually women sometimes, not supporting each other. And that was one of the core themes of the project, of the movie as well. So yeah, if you haven't seen the movie, I do recommend it.
Yeah, and if you're working in gynecology or women's health in general, maybe there's still a small window to leverage this opportunity from the Barbie movie and attract more women to your offices, or make sure that they are conscious about the things that they would need to be doing. So with these words, I'd like to wrap up the Healthusiasm podcast for this month. Thank you for listening. If you like the show, don't forget to hit the subscribe button on your favorite podcast platform. And by the way, you can also find us on the Shift Forward Health channel. It's a podcast channel of thought leaders who are actively designing and building the health and self-care business of tomorrow. For now, I'd like to thank our own thought leaders for their insights and healthusiasm. Thank you, Aditi Joshi, Aline Loiset, and Krupa Sutar. My name is Christophe Jauquet. We are the Healthusiasm panel, and would love to see you again next month for some more Healthusiasm. Ciao.
Thanks for tuning in. If you like what you heard, please spread the word. Tell your colleagues to tune in for all the awesomeness, then leave a review on Apple, Spotify, or wherever you listen. This show is produced by Shift Forward Health, the channel for changemakers. Subscribe to Shift Forward Health on your favorite podcast app, and you'll be subscribed to our entire library of shows. See our full lineup at shiftforwardhealth.com. One subscription, all the podcasts you need, and it's all for free. And remember, we might have a lot of work to do in healthcare, but we'll get there faster together. Thanks again.